How does medical apartheid harm social justice in health? Imagine a world where your race or ethnicity could determine the quality of healthcare you receive. Unfortunately, that world has existed and still influences health today. Medical apartheid refers to the unfair treatment and segregation of people based on race within healthcare systems. It is a form of injustice that directly clashes with the idea that everyone should have equal chances to be healthy and well. This kind of discrimination breaks the core principles of medical ethics. Respect for autonomy means people should make informed choices about their health. But medical apartheid often denies some groups access to important health information or the chance to participate in medical decisions. For example, when certain racial groups are excluded from clinical trials, they miss out on the benefits of new treatments, and their ability to make informed choices is limited. Beneficence and non-maleficence are about doing good and avoiding harm. When medical apartheid exists, marginalized groups often get less access to quality care. This can lead to worse health outcomes, more suffering, and preventable illnesses. For instance, if a community cannot access timely or proper treatment, their health risks increase. Sometimes, unethical medical experiments have been performed without consent, causing harm and deepening mistrust in the healthcare system. Justice in healthcare is about fairness in sharing resources, risks, and benefits. Medical apartheid creates stark disparities by giving some groups fewer resources, lower quality care, and excluding them from research. This unfairness leads to higher rates of illness, disability, and death among marginalized communities. It also hampers overall societal health because, when certain groups are left behind, everyone suffers. Historical examples highlight these issues. Black Americans have been excluded from many medical studies, which means treatments are less effective for them. The Tuskegee syphilis study is a notorious example of unethical research that caused lasting mistrust. Today, these legacies still affect how communities view healthcare, making it harder for them to seek help. In the end, medical apartheid harms social justice in health by violating fundamental ethics, creating health gaps, and eroding trust. Addressing these problems involves working toward fairness, respecting everyone's rights, and making sure all communities have equal access to quality health care. Only then can we move closer to a system where health equity is a reality for everyone.